Hello everyone. I hope and I believe you all are doing great. This is Dr. Arya, your pathology faculty, and today we will be studying about the Parkinson's disease. It is one of the most important segment of your central nervous system. And you know what? There will be one long question. There will be one long question from this particular topic. Okay, let's start. So Parkinson's disease is basically a progressive neurodegenerative disease. What is progressive neurodegenerative disease? In this disease, your neurons, you know what are neurons, right? Your neurons are getting degraded. Okay. Then what happens? There is a degeneration of neurons in the substantia nigra part of your brain. See, the two things that you need to highlight over here is first one, it is a neurodegenerative disease. Second one, the substantia nigra. So whenever it is asked as a long question or as a short note, just make sure to highlight some important points because that will fetch you more marks. Okay. What happens in the Parkinson's is there is a neurotransmitter imbalance between what? The dopamine and the cholinergic activity. There is decreased level of activity in dopamine in striatum, okay, and there is increased cholinergic activity. Next, let's just see about the epidemiology. It is basically a global burden. More than or equal to 10 million of cases of Parkinson's are basically seen. Prevalence is higher with age. As the age increases, there are higher chances that the person will develop Parkinson's. And the onset of this disease is if the person is more than 40 years of age, he or she is more likely to develop this disease. It is higher in Europe and North America, and the incidence are lower in Africa and Asia. So in our region, it is less as compared to the cases that are seen in Europe and the North America. Okay, next, let's see about the etiology and the risk factors. What are the risk factors involved? Okay, first one is your environmental. What happens in the environmental? The risk increases with the rural living. There are some disease which increases with the environmental condition of that person. Like I have told you when we were studying about the malnutrition, that people who are living in slum areas, people who are living in rural areas, the children, they are more prone to developing malnutrition as compared to the one who are living in the urban areas, because the condition of urban area is very, very good as compared to that of rural area. Right? So this also increases with rural area. Then well water. In well water, you will read about a disease called as, it is transferred from the organism of Canthamoeba. And recently, there are around 4 to 5% deaths that are seen in Kerala due to this virus only. Okay, so what happens? It basically resides in the dirty water. Next is the risk decreases with smoking, caffeine, and the use of steroids. Okay, NSAIDs. NSAIDs are used for the pain relief. So I'm not promoting anything like you should smoke or you should consume a lot amount of caffeine, but it is what written in your textbook, so we have to follow accordingly. Next one are your oxidative stress. Okay, in oxidative stress, what happens when there is a oxidative stress? When a body is pre-exposed to the oxidative stress, then there are chances that there will be the free radical injury. There will be free radical injury that will happen. Okay, then what happens is, then there is impaired protein degradation. There is impaired protein, the proteins that are there in the body basically gets degraded and the person develops this disease. It is one of my favorite topic as well. Then let's talk about the pathophysiology. And one more thing, the sequence which I am following to teach you this disease is the same sequence you have to write your exams also if it is asked as a long question, because it can be asked as a long question separately or they can give you a case, right? Let's talk about the pathophysiology. You have two pathways. What are the two pathways you have? First one are the direct pathway. Second one is your indirect path. I will explain you. Like you and your friend are having some disputes and now you both decided to solve that. Okay, you are not involving a third person because you know if you will involve a third person, there are chances that your fight will increase. So you are not involving any third person. Similarly, in the indirect pathway, I'll give you the example for this as well. Like if you want to go for a trip and you want to take permission from your father, who is the person you will involve is your mother, right? So your mother will act as a messenger between your father and you, and at last what will happen, you will not get the permission because your mother will influence your father that going for a trip is not safe for a kid. Oh my god, it's a rhyme. Next, in the direct pathway you have the D1 receptors, and in the indirect pathway you have the D2 receptor. Just remember D1 and D2. Next, D1 means involving one person, D2 means involving two persons. Okay. Next is the dopamine basically stimulates the D1 pathway and it inhibits the D2 pathway. Inhibits by means 2. By means 2. So it inhibits the D2 pathway. Then what is the more pathophysiology that you need to know? See, here are some mutations. There are mutations in the part 1, part 2 and part 3. After the mutation, what happens? The proteins in the body are getting misfolded. After the misfoldation, you will get a very beautiful body, and the classical feature of your Parkinson's, the Lewy body. The third thing which I am telling you to highlight. First, we have highlighted it's a neurodegenerative disease, Substantia Nigra, and then the Lewy body, and then the Lewy body. Okay, so this is the first thing. Second thing is what? Second thing is, after the misfolding of the proteins, what happens is there is disruption of the vesicles. The vesicles that are involved in your cells are basically getting disrupted, as a result of which the catecholamines level of your body are getting increased, and your body will suffer from the oxidative stress. After that, it will have the free radical injury of the cells. See this figure. If the question will come, you have to draw this diagram. Okay, you have to draw this diagram because it will fetch you very good marks. Trust me. Okay, here I have written what are the first thing that happens is the mitochondrial damage. How the mitochondria will damage? Either there are exposure to the toxin, either the person is very aged because aging is also a risk factor, or either there is Parkinson gene mutation, right? These three things are there which will cause the mitochondrial damage. Then what happens is there is a reduction in the ATP. There is reduction in the ATP. When there will be reduction in the ATP, what will happen is the reactive oxygen species will increase, right? The ROS increased. Then what happens is there is synaptic dysfunction. What do I mean by synaptic dysfunction is that you have this, like you have a junction between both the neurons, like you have the junction between the neurons. This will be your presynaptic, and this will be your synaptic, right? So what happens in this disease? There is the neurons are not the signals, basically. The signals are not transferring from one neuron to another. It's having difficulty in transferring the signals from one neuron to another. As a result of which, what will happen? If you are doing a teamwork and there is no coordination between your team members, what will happen? Obviously, the work will get very poor, and you are not able to do that work properly, right? Similarly, your brain also will function in that way, and your brain will not be able to coordinate with the other organs and not be able to do the activities properly. Okay. Next, you have the pathology, that is, you have the gross image and the microscopic image. See, the gross image will be kept as a specimen in your spotting exams. So, this one is your normal. In the normal, what you are able to see? The substantia nigra area is basically black, and in the Parkinson's, you are able to see, oh my god, the black pigmentation, where it has gone. So this is what happens. In Parkinson's disease, there is a target to the substantia nigra, okay? Gross and microscopy. So there is depigmentation of substantia nigra. See, the black color has gone. There is depigmentation of the substantia nigra. In the microscopy, what you are able to see? Lewy bodies. I have told you to highlight Lewy body, right? What are these Lewy body? Let me just tell you that also. This. You are able to appreciate this figure, and you are able to appreciate this petal-like, not petal-like, a leaf-like structure. These are nothing but your Lewy body. These are nothing but your Lewy bodies. Okay. Now, next is you have a staging system for your Parkinson's, that is your Braak staging. What happens is it basically tells us the spread of Lewy body is the spread of Lewy body in your Parkinson's disease. In the stage 1, it involves the medulla and the olfactory bulb. What are the symptoms that the person will have? The symptoms that the person will have is the anosmia. The person will not be able to smell that things, right? The same symptoms that we have seen during the COVID era. Second one is the constipation. In the third and fourth disease, there will be the Lewy body will spread to the substantia nigra, and there will be motor symptoms. I will tell you the clinical features of Parkinson's also, okay? In the stage 5 and 6, you will be having hallucination and dementia, okay? Hallucination and dementia, and that you will learn more in your psychiatry lectures. Let's see about the clinical features. They are very important because they can be asked separately also as a short note, right? So I'm just writing it over here. They can be asked as separately as a short note. So it is that important. What are the clinical features you have? First one is your tremors. What are tremors? Tremors are the involuntary movement of your hands like this, okay? And if the person will keep a paper, I'm not having a paper right now. What I can keep, okay, just wait, give me a moment. I'll just take a paper. Okay, like these are the tremors the person will have of his hair. And if you are not able to appreciate the tremors, if the tremors are of less duration, then what you can do is you can just keep the paper above the hand, and then are you able to appreciate the tremors? So you will be able to appreciate the movement of the paper, okay, and you are able to appreciate the tremors. So this is basically the procedure that we do in our OPDs as well. So you have what kind of tremors? You have the resting tremors and the pin rolling tremors. What are the pin rolling tremors? The person will do like this. Okay, the old people, they keep on repeating like this. Next that you will be having is a rigidity. This you need to know very well. Rigidity. Pin rolling tremors, then the rigidity, that is your lead pipe and the cogwheel. Okay, lead pipe and your cogwheel rigidity. See this old man, you are able to see there will be a stooped posture of the person. Then there will be back rigidity. The back of the person will be very rigid. There will be hand tremors, right? There will be tremors in the legs as well. Okay, although I have not seen the cases in which both the things occur simultaneously, but there can be tremors in the legs as well. There is stepped gait. You know what is stepped gait? Stepped gait is like hopping on one leg and then keeping your leg again, right? That is basically a stepped gait. You are not able to keep both the feet together. Next that is there will be micrographia and there will be hypophonia. The blinking rate of the person basically decreases, and there is postural instability. As we have seen, the patient is stooping forward while moving, right? Then what are the other features you have? You have the pestinating gait. They are the short and the accelerating step. The patient will take a very minute steps, okay? Like if I want to travel a distance of 1 meter and it took me, let's say 2 or 3 seconds, not 2 or 3, it took me 5 seconds. So for that person, similarly, that will take approx 30 to 35 seconds to cover that much of distance, okay? Because he is taking small cute little steps, right? Then next you will be having is the freezing phenomena. What is freezing phenomena? The feet are basically stuck to the floor. The patient is not able to uplift the feet. There is drooling due to impaired swelling. What is drooling? Drooling of the saliva. There will be saliva which is coming out from the corners of the mouth, okay? Next, what are the non-motor symptoms you have? There will be depression. There will be anxiety. The person will become so anxious, right? Hallucination will be there. There will be constipation, orthostatic hypotension. What is orthostatic hypotension? The hypotension which occurs while the person is lying supine. Okay, there will be urinary urgency, and we have seen in elderly people also it's normal to have urinary urgency, right? There will be erectile dysfunction, and the sleeping disorders, you will have the REM behavior disorders. REM means the rapid eye movement. Okay. In the sensory, the person will have anosmia, pain, and paresthesis. Okay. What are the investigations you will order? First one, we will make a clinical diagnosis based on the brain back criteria. Then you will order the DAT scan. In the DAT scan, you are able to see there is decreased in the striatal dopamine uptake. The striatum is not able to uptake the dopamine. Then you will do the MRI to rule out if there is any structural lesion that is there or not. Then you will do the PET scan. PET scan is to show the metabolic changes, because with the metabolic changes also we can appreciate that the person is having the Parkinson's disease. Next staging that I want you all to understand is about this staging. And this staging, what you are having, stage 1 is unilateral. This means the issues are confined to the one side. In stage 2, the issues are confined to both of the sides. In stage 3, the person will develop the postural instability. In stage 4, there will be severe disability and the person needs help. And in stage 5, the person finally becomes bedridden. Okay, the person is not able to do his or her work properly. He needs some amount of help. Now, what is the differential diagnosis that you will make? First one is the Parkinson-plus syndrome. Second one is your multiple system atrophy. Third one is your dementia with Lewy bodies. Fourth one is your corticobasal degeneration. These are basically the differential diagnosis that you will make. Then let's see what are the treatment option we can give to the patient. First one that you will read in your pharmacology also as well is about the levodopa and carbidopa. They are basically the gold standard. Your keyword number 5. First keyword was neurodegenerative, Substantia Nigra, Lewy Body. Okay, this is the fourth keyword, the levodopa and the carbidopa. What are the side effects of them? Nausea, vomiting, obviously. Nausea, then dyskinesia, then there will be hallucination. Okay, second thing that you can give is the dopamine agonist. Here, the side effects are there is impulse control disorders. Then you can give the MAO-B inhibitors. Okay, and they are basically, they don't have much benefit and they are slowly progressing. What is the surgical option you can give to the patient? For the surgical option, you can have the deep brain stimulation that targets your subthalamic nuclei and the globus pallidus. Right. What is the supportive therapy that you need to give to the patient? For the supportive, you will offer obviously the physiotherapy first, because the person is having so much of stiffness. Obviously, the person will have so much of pain as well, right? So you will offer them physiotherapy. Then is the speech therapy, and then the diet. You will offer the patient high fiber diets and hydration. Lastly, you will offer the patient the psychological support. So this was all about the Parkinson's. Let's see the summary that table that you have. First one is the first motor symptoms are tremors. The tremors. Okay. Non-motor symptoms are your anosmia. Hallmark is your Lewy body. Gold standard drug is your levodopa plus carbidopa. Best for tremors is anticholinergic. Best for dyskinesis is. Then the protective factors are smoking and caffeine. Then your DBS targets the subthalamic. Your DBS targets the subthalamic nucleus. So this was all about the Parkinson's disease. I am giving you one question, and your question is, which of the following is a risk factor for Parkinson's? Okay. Is it the smoking? Is it the caffeine? Or is it the well water? So the answer is obviously the well water, right? Because via the well water you will be able to the person will develop certain amount of diseases. Okay, so this was all about the chapter. If you are having any sort of doubt, feel free to reach me, feel free to DM me, right? Thank you so much.